Vidyashankar AV. Thank you so much for joining us.
Thank you,
So,
Sindhu.
thank you, Mr. Vidyashankar. A little bit on this. Dr. Radha is a retired Army veteran. She has served over 22 years in the Indian Army as a family physician in both peace and field areas across India, from Kashmir in the north to Kunnur in the south. Post-retirement, she has worked in the corporate sector as a physician in the wellness division. She has also worked in the developmental sector with World Health Partners, which is funded by Bill and Melinda Gates Foundation, for their projects for providing telemedicine consultations to parts in rural Bihar. She has done over 3,000 telemedicine consultations while working with Project StepOne in states of Delhi, Karnataka, Maharashtra, Punjab, and Bihar. Thank you so much for joining us, ma'am.
Thank you so much, Sindhu, for having me. It's been a pleasure to be on this platform with you all.
Thank you. Mr. Vidyashankar is the founder of Abhinava Group, and he has over 3 decades of illustrious experience in doctor and healthcare company relationships. He has mentored several startups that have gone to reach the Fortune 500 list, and is also a very strong pioneer in the healthcare and event management space. He's one of the founding members of Project StepOne, and he has several years of experience in the pharma industry. Thank you so much for joining us, sir.
Thank you very much, Sindhu, for having me here. I'm happy to be here.
Great. So I would like to start with asking the both of you, like everyone has been talking about the impact of COVID and how difficult it has been on people. But, increasingly, wellness and mental health have become important factors. So I wanted to understand from the both of you, what can individuals do so that they can have a healthy body and mind during this pandemic?
So what essentially is in this pandemic, it has really played havoc with both families, individuals. And so the most important thing which I feel is for an individual to have a very positive frame of mind. It is very important that you keep your thoughts in a very positive direction. There is so much gloom and doom around you that it is very important to stay focused and away. Do not watch too much of negative news on the TV. Do not read too much of negativity, but keep your mind very positive. Secondly, I feel this is a golden time for families to reconnect with each other. Contact is very important for parents. They have got a time to spend with their children. Children have got time to spend with their parents. So use this family time to get to know one another, spend time with each other, play games. For individuals who are living alone, I strongly suggest pick up a hobby, pick up a passion. There are so many things in life which we wish to do, but we never find time to do it for ourselves. Read a book, sing a song, learn to pick up a music. YouTube is such an inspiring tool. You can easily pick up something from there. So we always suggest to people that do whatever you can to make yourself happy. Cook a nice meal. There's so much stress you can do on physical fitness, do yoga, do a workout routine, lose weight. That has been one of my prime important things which I've been trying in the lockdown, is to try and lose some weight. So there's so much you can do with yourself.
Thank you so much, Dr. Radha. Thank you so much. Vidyashankar, what can we do to keep focus on wellness?
So my ancestors used to basically tell me always that one phrase in Sanskrit, yad bhavam tad bhavati. You'll become as and what you think, basically. So mind, body and soul is one of the very, very important aspect of this particular physical body. So unless until that is aligned, so you can't basically focus on anything wishfully and willingly. And as ma'am was repeatedly telling that you have enormous opportunities to pick up any one of your wonderful hobby which you have aspired since your childhood days. And age definitely not a matter at all. I think last decade has seen a huge transition in understanding a difference between independence and the liberty. Though there is a very, very thin line in between those two, we have taken everything, how, whatever we think. So it is called as like, swechachar. हमको जो भी चाहिए हम करना चाहते हैं. That is definitely not a right way of thinking and approaching our own hobbies. Every weekend, like, most of my friends' doors were locked and we can't visit them. It looks like we have lost them. And between Monday to Friday, it is always like, the work and the stress, those weekdays, everything. And most of the central libraries which I used to visit have become so vacant. Nobody is there to pick up a book and read for 10, 15 minutes or come back. And no gup shop, like, most of my coffee joints basically goes only with the smoking, nothing else. Those days, the sanctity was totally different. So I feel like, you need to focus. That is what it is called as tapas. Whatever you do, focus, grow, and enjoy. If you just start changing the order, you will lose the whole life.
Right. Thank you so much. Thank you, both of you. Now, coming down to what's happening on ground. Dr. Radha, I want to start with you. In your 300 plus consultations that you've made for Project Step One, could you tell us some of the commonalities you've noticed in, COVID-19 patients, and what steps they can take to ensure they heal and recuperate faster?
What we have noticed is in the first wave, when the pandemic hit us, there was very little actually we knew about coronavirus. But when the patients used to come to us, we found that their presenting symptoms were mostly fever. They used to come with body ache, muscle pains, and symptoms like that. An odd person used to have breathing difficulty, nothing too much, or maybe slight pain in the chest. But what we are finding this time is that the virus is much, much more virulent as compared to what it was last time. In spite of the fact that we have so much knowledge on COVID now, we have so many medical treatments available to us, yet there is so much yet that we don't know. This time the virus is presenting with very different symptoms as the first. Like what I essentially notice is that patients who are in the early stages, they will complain of throat pain, very severe throat pain. They'll complain of headache. They'll complain of very bone-breaking body ache, which is absolutely unbearable. But what is most worrying, which we are finding, is that they come for the first time with very low oxygen levels. That this is what is very, very worrying, because with the scarcity of hospital beds, with the lack of oxygen available, these patients tend to deteriorate very, very fast. So what happens is that this time the virus, instead of hitting the other systems, is going straight and deep down into the lungs. So the patients come to us in a very critical state with lack of oxygen beds, with so much problem with oxygen. We need to do our level best to stabilize the patient and keep them safe and comfortable at home. So what we do is when we assess the patient, we talk to them, we see what their oxygen saturation is. We advise them as much as possible on home remedies, what they can do to reduce the throat pain, what they can do like to keep up their oxygen levels. Awake proning is very, very helpful. We have found that if we teach the patient awake proning, that is lying on his stomach and in a correct position, oxygen levels tend to come up by as much as 5 to 10% points. So then we advise them correct way, how to lie on their stomach for some time, to take a turn to the right, to sit up, to turn on the left side, go back, and to avoid sleeping on their back as much as possible. So then we also advise them certain other deep breathing exercises to increase the lung capacity. Since we tell them keep your doors and windows open, sit in front of a window, breathe deeply over there, and do things. Keeping their minds alive, active, these are all very, very important things. So these are the suggestions we give to patients to try and keep them as far as possible safe at home.
You're muted.
Wanted to understand one thing. When none of us have been a part of a pandemic, nobody has been in a part of a pandemic, and I think it was decades and decades back that people have been exposed to something like this. we see that startups, individuals, corporate houses, everyone have rallied together to fight COVID. So, what steps do you think individuals can take to help their family and friends in times like this? Because there's no single person who's not been impacted in this second wave. So, would like to understand.
You rightly said, like, an individual definitely cannot make an impact which is expected as such. So that is why, like, I again recall my grandfather's telling that, like, Sange Shukti Kali Yuge. It means that in this particular era, once you become united, then only you can fight against anything. So that is how the StepOne got born in March 2020. So our captain, founder, Rax, Raghavendra Prasad, basically uh, willing to bring in the technology, people, and processes together and build StepOne. That is where, like, StepOne started reaching citizens with the help of so-called the spine of the StepOne, 7,000 plus doctors and around 3,000 citizen volunteers and more than 1,000 functional volunteers. So, as technology played a major role in StepOne, we could able to reach out the COVID affected citizen through a doctor for their telephone triaging. And now we starting with Karnataka government, we reached around 21 plus state government still yesterday. And we bring in 4 to 5 different range of products or solutions for every state. For example, we give open hand for telephone triaging from the doctors, even for the citizens volunteers. And we also managing plasma banks, especially in Delhi and Gurgaon and Chandigarh. And we are also trying to help mental wellness through again telephone triaging with the lot of willingful counselors. And we also do home isolation. This is one of the major aspect where a patient can adhere to the home isolation protocol as per designated by every state government. And our doctors basically monitoring between first day of their positiveness to fifth and fifth to 10th, 10 to 15th, till they become, like, very well adequately healthy. Our doctors from StepOne have been following every patient, and in between, if they want, like, some sort of hospitalization or some critical care, they escalate. If you take in Karnataka as an example, in Bangalore we basically work with BBMP and other district with the district administration and other things. So what I suggest is, especially for youth, like, as Vivekananda has told, our youth is the leaders in our future. They are the pillars of our developing nation. So, like, in last, I think, 2 months, we have seen the very, very young age, between 20 to 40, youth have been affected very, very badly with COVID-19. Maybe because, like, they think that our immune system is so good, we can get over everything and anything, and not following the guidelines as described by either a doctor or the government or even the household people. They don't follow SMS, like, no social distancing, no masking, no mask ups, and even sanitization. So maybe that guidelines are very, very essential to curtail this, random spread of COVID-19, I believe, Sindhu.
Right. Thank you, Vidyashankar. Uh, you know, Dr. Radha, everyone has said it's a virulent form. It's extremely dangerous. There is a lot of loss of life. People are very serious. But what steps can we take as citizens? Before all of us get vaccinated, what steps can we do to stay safe and also help others?
The most important thing which we need to follow and be very, very conscious of the fact is to follow COVID appropriate behavior. There's no escaping the fact that for a near future, for many months to come, COVID appropriate behavior is going to be the bedrock of controlling COVID infections. Wearing a mask at whenever you're stepping foot out of the house, physical distancing, the do gaj ki duri, which we keep emphasizing about, is very, very important. Hand sanitization, whenever you go out, whenever you come back, wash your hands repeatedly. This is what is very, very important. Then next, what we suggest is that you must avoid crowded places. We have seen in the month of February when we were in such a good position, figures had come down so much, but everybody, maybe COVID fatigue, maybe for whatever reason, absolutely went berserk. Going to markets, we saw the pictures over TV, crowded marketplaces, malls, restaurants, movie halls. So we have to be and take a very conscious decision that if we have to fight the pandemic, we need to follow COVID appropriately. We need to avoid these crowded places. Step out of your home only if it is absolutely essential. Whatever you can manage at home, whatever online deliveries can produce, even if we have to go with a little less, it is better to go with a little less and be safe than go out and opt for more. Then we need to also say that for people who are at home, consolidate whatever you can, get your resources together. What happens is that at the time of an emergency, people are running around in circles. They don't know the ambulance number. They don't know the hospitals nearby. They don't know there's a wild panic. So I tell all my neighbors, I tell my own family that we must have a list at all times ready. Which are the nearest hospitals? Which are the COVID hospitals? Who are the doctors near you? Where is oxygen available? So all these precautions, if you put in place, it's like an insurance. You have everything in place at the right time, then you'll never be in a panic when things happen.
Right. You're absolutely right, Dr. Radha. Vidyashankar, just want to understand, tell us some of the awareness building exercises and steps that you've taken over the past few months.
Well, from StepOne's perspective, one of the major and very, very important thing what we have started is about creating an awareness amongst all the citizens across India. You might have seen our social media campaigns. Every day we give the tip, of course, from the fellow doctors with their experience. What are the smallest things, you need to build within your house? How do you basically, keep yourself away from this particular virus? And with the help of our doctor experts, we have created so many video bites, which explains, what is the importance of believing the right facts. As Madam was very clearly telling, Vaidyo Narayano Harihi. So we should have our family physicians number very, very handy. And friend in need is a friend indeed. A good friend's number has to be kept very handy. And a trusted NGO like StepOne has to be accessible. They should have the toll-free number. They should be able to access. And every day, at least call upon around 5 fellow friends or known people, whether how is their health, are they doing well, any help has to be extended to them. All these each steps is been consolidated within StepOne, and StepOne is offering a sort of a complete package of how a citizen can stay healthy within these gloomy days, how he has to basically even go to the shopping, how he has to reach the doctor. And teleconsultation, telemedicine is one of the major aspect of the StepOne. So we have reached more than around 30 lakh citizens, especially during the first wave, that is between March 2020 to December 2020. Of course, with the help of doctors like Dr. Radha, she has covered around 3,000 patients. It is not an easy thing sitting at one place and calling upon the doctors, taking their feedback, taking their stress and making them more comfortable. So what I urge all the viewers and across the viewing system is that please stay home. This is the time where we need to survive. कमाने के ज्यादा काम कैसा हासिल करना है वो देखना है पहले. So stay home, stay safe. That is the important thing.
Right. On that note, Dr. Radha, I want to ask you, everyone is looking to step out now, just at least for the vaccines and all of that. But there still are so many myths on it, and many are still reluctant to get vaccinated. What are the biggest misconceptions, and how do you debunk them? How do we, through this conversation, ensure that more people go and get, vaccinated?
Yeah, even we are finding that there's a lot of vaccine hesitancy and there are a lot of doubts in people's mind regarding whether they should get the vaccine, they should not get the vaccine, which vaccine is better, which vaccine has got more side effects. So, and because in a way, WhatsApp forwards and social media has also played a very negative role in putting a lot of this in people's minds. But what are some of the commonly felt myths which people have is firstly, people feel that this vaccine is not at all effective. There's no point in taking the vaccine. The reason for this is that people feel that the vaccines were rolled out in too much of a hurry and not too much scientific backing is there to support it. But I want to make it very clear to our viewers that both the vaccines available in India, Covishield made by Serum Institute and the Covaxin made by Bharat Biotech, are very safe vaccines. They are meeting all the criteria of the international standards, and a lot of study has gone in before releasing the vaccines. So this thing that whatever the people feel that they have not undergone phase 3 trials, they have not undergone, is not really thing. The vaccines are effective, yes. They are safe, yes. They develop an immune response in the body has also been proved. So this needs to be in the mind of people that vaccines are effective, they are safe, and people need to vaccinate.
Right. Just on that people need to vaccinate, I think there's also a hesitance because there are a lot of stories of people who have been vaccinated getting COVID, right? So people are hesitant because of that also. And while it has been reiterated many times, if you just add and tell why is it still important that, to get vaccinated, it would be great.
Because what happens is when a lot of people are developing COVID even after taking the vaccination. The reason for this is twofold. One, that most probably they may have been going in for the infection before they went to vaccinate. And just a coincidence that the vaccine and the COVID appeared at the same time. Secondly, they may have picked up the infection while they went to the vaccination center. What is people don't know is that the vaccine and the property antibody formation occurs in the body, starts forming only 2 weeks after the second dose. The first dose is just a primer to your body, telling the body that, look, I am entering your body, please get stimulated and start forming antibodies. That is all that the first dose does. The 2 weeks after the second dose is when the formation of antibodies actually occurs. So it is very, very important after you take the first dose that you continue COVID appropriate behavior. You need to continue wearing a mask. You need to maintain physical distancing. You need to do hand washing and you need to avoid crowded places. Most people feel that I am vaccinated. Oh, 3 cheers. Now I needn't wear a mask. I can go out. I can do what I want. It's not like that. Immunity starts building only 2 weeks after you get your second dose. So even after taking the second dose, it is very important to continue COVID appropriate behavior and to stay safe and keep your family safe.
Mr. Vidyashankar, I just want to understand, startups, communities, companies, everyone has either lost colleagues, friends, families. It's been a harrowing time within employees, for people in general. How can startups help their colleagues in times of crisis? Like, suppose a colleagues whose parents or someone of their family or him themselves are in hospital, you cannot go visit them. The usual human touch that really helps people is just not there right now. What steps can you ensure to help them, and how can you ensure work-life balance? It's becoming extremely critical nowadays. So how does that work?
Well, we are now in the second wave. So by this time, I think most of the businessmen, corporate companies would have understood how a employee has to be basically secured enough for that particular company. As any company takes care of fire imbalances, with the fire extinguisher and any other unwanted incidences or accidents to happen, they would have insured everyone, they would have insured their assets and other things, as they would have taken care of all other unintentional accidents or mishaps. COVID-19 also has to be curtailed through one of the major important thing is work from home. I think most of the companies now have very, very clearly declared work from home. So that is one of the important step. Second is employer has to be basically thought of uh, engaging a family physician or a physician for a continuous monitoring of their employees, their wellness, about whether how their family people are doing. And you might have seen companies like Infosys, Wipro, and they have already adopted even ICU ventilators, beds, and everything for their employees in case of something bad incident basically happens. So, and now coming to the insurance level, COVID-19 policies have become very, very famous, that covers up to almost around 10 to 15 lakh rupees with a minimum amount of premium, which companies can definitely take up. And general insurances play a major role. And uh, and once they enter into the office, again SMS has to be followed. They can make shift 30% on each day, or 50% on each day. Every week on they can create a different rosters, and only important core team people can come and work. And along with that, very, very obligated teams, accounts, designing, something like that, those people can come and work with their desktops and other things. Otherwise, all the measures an employer has to take to keep the employees safe and work from home without fail, ma'am.
Great. My last question, it is for the both of you. While there's a lot of worry and panic and everything, I would like to hear some stories and anecdotes, possibly of recovery and people doing well. If both of you can send some examples from your own personal experience, we can leave on a positive note. Dr. Radha, if you could start.
The greatest part about StepOne is the platform it has given us for all of us in some way or the other to contribute to society and to give back to it. At the time of pandemic, when there's so much gloom and doom, when we reach out to people, when we talk to them, we console them. Very often a patient will tell you, मुझे बहुत अच्छा लगा आपसे बात करके. They will just say कि हमारे मन में जो दुख था वो चला गया है. मैडम बहुत अच्छा लगा आपसे बात करके. Simple things like that gives you a very feel good feeling that in some way you have shared their sorrows. I still remember when I was very new to StepOne, when we had just launched in Delhi. At that time, there was a young boy who came for a consultation. He was just 14 years old. He had lost his father into COVID. His mother was critically ill. And all he wanted was, he had given StepOne a call asking that just tell me, how do I look after my mother? I have to save her. Those was one of the most touching moments of my life. I spent 45 minutes with that, explaining to him everything what he needed to do. I asked him after I had finished, ki now you tell me what you have understood and what doubts are in your mind. We spent a lot of time talking to each other, this young child and I. At the end of it all, when he told me, Auntie, मुझे अब समझ में आ गया, मैं अपनी माँ के लिए वो करूँगा जो कभी किसी बेटे ने अपने माँ के लिए नहीं किया. I till today remember that child. It brings tears to my eyes. And I thank StepOne that we made such a difference to this child. There are stories like that, which makes your day. I still remember that child. I still think of him. We were so raw at that time. We hardly knew anything. But that is even prevails today. The other day, again, I was doing a consultation, a young child. Everybody at home was COVID positive. He was only COVID negative. I taught him how to boil eggs. I told him how to buy bread, give it with milk. Then when the child tells you, okay, now I can look after my parents, you feel so happy. And I'm so grateful to StepOne for giving us this magnificent chance to reach so many people in the interiors of their home, to be able to do for them at this time when whole families are ravaged by Corona. To be able to reach their homes and to do for them is one of the most humbling experiences of my life. These people really make your day. When one person just has to say thank you, One person has to say, God bless you. And that is enough to keep you going for many, many more consultations.
Thank you. Those were really touching stories. Very, very touching stories. Anything from you, Vidyashankar?
Yeah. So I think in April 2020, when we just started, a few of our volunteers touch basing, like, COVID affected citizens, and citizens were clueless, like, how to basically reach a doctor or an administration to take some sort of help. One of my colleague, Jyoti, when she was calling such COVID-19 affected citizen, she reached out a family where there were 8 blind people. So unfortunately, and they were basically struggling without food for almost 3 to 4 days, because they never knew that the lockdown has been called, and there were no nearby houses, and they could not basically step out and bring anything, and phone calls were not basically accessible for them. So Jyoti immediately took their number and escalated to one of the Karnataka government official. The same day evening, Jyoti got a call from that Karnataka government official and took the complete details of that family. Within next 2 hours, one of the Raichur district administrative person has went with all the provisions and handed over everything. And surprisingly,
Wow.
Jyoti caught back the call from that blind person, and he was just like, crying. And Jyoti was in touch with that family for almost around 2 months, I believe. Every weekend she used to call, console them, and lot of, like, blessings were showered on her and step one. They were unable to basically speak. Every time they used to cry. That was one of the very, very touch story which our experience I came across. And as ma'am was telling, step one has made everyone to come together, even sitting very, very distant. They're not meeting anyone physically, but everyone has been touched with their care. And to say that, like, our philosophy very clearly says that we have 6 runas. That is, Pitru runa, we have Matru runa, we have Deva runa, Rushi runa, then we have Manushya runa, and Bhuta runa also. Unless until, like, we touch base every runas and clear our own debts, that is what it is called as paropakarartham idam shariram. Unless we give this body to the society to serve something good, nothing can make us more happier than this. So step one has reached more than 50 lives and made them to understand, even in these gloomy days, step one, like, NGOs can reach every citizens across nook and corner of India and help them, and gives hopes day on day with the help of people like Dr. Radha. And I'm very thankful to her to be with us from the day number one.
Great. Thank you so much. Thank you, Dr. Radha. Thank you, Vidyashankar. Thank you so much for talking to us. And thank you. Hopefully, we have debunked a few myths today with this and some more as we go forward. Thank you, everyone.
Thank you
Thank you
so much.
very much.
Thank you,
Thank you,
Vidya.
Dr. Radha. Thank
Thank
you,
you.
ma'am.